Hello, my name's Sharon Fox. This is one of the most bizarre things I've ever done in my whole entire life. I'm actually talking to myself in a camera, and I can't actually stand to look at myself in a mirror, let alone talk to myself in a camera. But anyway, let's see how this goes. I'm going to be sharing my experiences with breast cancer with you all through the whole of October, which is obviously Breast Cancer Awareness Month. I'm going to give you a brief introduction to me and what I've been through. Some of you may know me from the Tamworth Herald. Okay, so here we go. I was a 39-year-old mum of 7 when in September 2008, with my 2 youngest children being just 9 months and 2 years old, I found a pea-sized lump underneath my armpit. I saw the doctor, who sent me for immediate tests within 2 weeks. I had the all clear after an anxious wait for the results of a fine needle aspiration, mammogram and ultrasound. The lump didn't go away, and I continued to keep an eye on it. The medics said that it was enlarging due to the swelling from the tests. I kept myself busy setting my own nail and tanning business up, as well as working part-time in a hotel reception, and also planning my wedding for July. And in February 2009 the lump got bigger and was by now almost eyeball size. I was also experiencing a lot of pain in my left breast and noticed that the skin was going a bit shriveled. As I'd always been very proud of my quite pert 32 double J's, I noticed straight away that the appearance was getting somewhat quite less desirable. I went back to the same breast clinic and saw the same experts, who by now were telling me a totally different story. They actually had to double check the slides from the previous tests, as the findings were so significantly different. They were different, not in a good way. I was diagnosed with invasive ductal carcinoma, grade 3, and there were 3 tumours, each approximately 3 centimetres, and a mass of DCIS. The eyeball-sized lump was a lymph node that had become infected with cancer. Within minutes, I was advised to have a mastectomy. They wanted to do the mastectomy 3 weeks later, followed by chemotherapy, radio and Herceptin. I opposed this as I had been misdiagnosed, as if I had been misdiagnosed previously, then who knows where the cancer had spread. I felt that obviously this lump had been growing since September, and if it was anywhere else in my body, I wanted to get the chemo in straight away.